to Smile Squad.
Hi, and welcome to the Live with Nikki show. I am so excited to be joined by Dr. Lori Goldenberg. We are at Smile Squad Kids Dental located in Toronto, and we will be talking all about Halloween, how to prevent cavities when your kids go wild and eat all of that sugar. So we're going to be getting into that, but I just want to introduce Dr. Lori. So she has made it her mission to impact the lives of children. She studied physiology at Western and then went on to do a residency at Sick Kids Hospital where she fell in love with pediatric dentistry and did her master's. She loves kids. She always pays attention to their body language and to their needs, which she thinks is very important. My kids love going to her. They actually beg to come to the dentist. If you come to Smile Squad, you guys will see that there is a little play area in the front. There's a clubhouse. There's stickers. They get to pick a prize at the end. And it's really enjoyable for the kids. So it takes away all the anxieties of coming to the...
That was the idea. When we created the space, we wanted it to be as kid-friendly as possible. We don't want kids to be scared of the dentist. We want to create a positive experience from day one. And I think from the feedback that we've gotten, people are super happy with it.
And you achieved it. And there's a whole toothpaste wall, which you guys saw in the beginning of the video. It makes the kids feel comfortable in their environment. It makes it a little more fun. There's yellow everywhere, which is a happy color. And my kid actually had a cavity filled. I hate to admit that. And there's
so did mine.
Okay. And there's a little piggy mask that they wear. Sienna wasn't even scared when she came to you. At all, and she's begging to come back, so that just shows you how good she is. When Lori isn't working, everybody knows that you can find her at the farmer's market. She loves biking, she's into fitness. I can't do a workout class with her because I'll die. But, so what should parents know about, preventing cavities? What's the number one thing so that they're not in the situation that I am?
So first of all, cavities are very, very, very common, and even if you do everything possible to prevent cavities, your child might still end up with them, so don't feel guilty. I'm talking to people about this all the time because they come in and they feel so upset and guilty about the cavities, they did them or they didn't do enough to prevent them, and sometimes there is definitely more that parents can do, but
my husband will beg to differ.
A lot of the time, it's there's a genetic component. So parents who have had a history of cavities, you can't really change that. But there are things that you can do to prevent cavities, obviously brushing. And brushing in the correct way is very important. Lots of kids collect plaque along their gum line, and if you're not brushing properly, you don't see what you're doing. I think a lot of parents go in blindly and just kind of brush like this, but you really have to see where the brush is going. You have to make sure you're contouring the gums with the brush. And obviously using fluoride toothpaste is important if your child can spit, and sometimes even earlier if they're at high risk for cavities.
What if they don't spit? Because Sienna swallows a lot. Is that really bad?
So for kids that don't spit, but they're at a certain age where we think that they should be using fluoride, or if they're high risk for cavities, we'll recommend using a very, very tiny amount of fluoride toothpaste, the size of a grain of rice. Okay. So that even if they swallow that amount, it's not going to be detrimental. We don't want them eating tubes of toothpaste, but a tiny little bit is not going to harm them.
Okay. I feel better a little bit.
Yeah. So that's brushing, really important, obviously, twice a day before bed and after breakfast. Flossing, really, really important. A lot of people think that if there's gaps in between the front teeth, there's also gaps in the back, but a lot of the times the molars are touching, and that's a really common spot to develop a cavity. In between the molars, you gotta floss every night, super important. Diet is obviously very important too. You wanna try to limit the snacks during the day. Anything dry is not great for teeth. It kind of gets stuck to the grooves of the molars, gets caked in there, and not great. So anything fresh is always better than anything dry. So fresh fruit better than dry fruit. Fresh bread would be better than crackers. Dry cereal, granola bars, cookies, all that stuff is not great for teeth. And the more often they're consuming it, it's not the amount that they're having necessarily, it's like the timing. So if they're having like a snack and then another snack and then another snack, another snack, their mouth is acidic the whole day versus having like a cookie right after dinner or like, you know, something like that with a meal. It's going to be like a lot better for the oral health. So it's not that they can never have any treats or any junk food, because like it's really hard to avoid it, but you just want to try to limit the snacking and maybe give them something like with the meal. Try to limit juice. We don't buy juice in our house at all, so it's not hard.
Water it
to
down.
have juice.
I water it down.
You can water it down. You can water it down, but it's also very good for kids to become used to just the flavor of water,
right?
Because that's like the healthiest thing that they can drink. And I think that those are like the major things that I see that can be improved upon. But if they do get a cavity, it's not the end of the world.
Right.
You know, if you come to a place like this, there's things that we can do to make kids feel comfortable, and it's not so bad. And parents often come in very anxious about how is my child going to react, and they're often very surprised that their child is great, like you.
Yeah, I was. And what about like the I don't know what it's called, the little thing that they like go in between the teeth instead of flossing? You know, could you use those on children, or is that like
the floss sticks?
Yeah.
Yeah. So you can use regular floss. You can also use floss sticks. Floss sticks are maybe not as environmentally friendly, but they do work for flossing, and they are easier to use for kids. Like if you're flossing for somebody else, floss sticks are a lot easier than regular floss, so you can definitely use those.
Like we talked a bit about cavities, but how do you fix cavities for little kids?
So it really depends on the types of cavities that the kids are getting and how old the child is and their level of cooperation. So we offer we can do treatment in lots of different ways. So if a child has like a cavity or a couple cavities and they can sit and they're comfortable, we could do it in the chair. They're watching TV. Sometimes we use laughing gas. It's pretty like non-invasive, and the kids are oftentimes very good with that. We also get kids who have like a ton of cavities, or they're like too young to be able to understand what we're doing, and for us to be able to get them to cooperate for the treatment, because it is a lot for like a 2-year-old or a 3-year-old to sit down and like they don't understand what we're doing or why we're doing it. So that age group is tough. So we have something called oral sedation, which we can give them to drink before the appointment, and it helps them feel relaxed. They don't remember anything that we do during the appointment, and it makes it a much more pleasant experience for the child, for the parents. Like everyone is happier.
How long does it take to wear off?
Probably about an hour, like probably fully back to normal in about 2 hours.
Kind of laughing gas about this.
Laughing gas, like as soon as we turn it off, we give them some oxygen and they're back to normal.
Right. Yeah. Sienna was fine after. I couldn't believe it. I was like,
they can go to school after.
I know. I was like, is she gonna have to miss school?
Yeah. It's very, very mild. They give it to pregnant women when they're delivering babies. Like
right.
It's pretty mild sedation. And then for kids that have a very high volume of treatment, lots and lots of cavities, or they're very, very young, we can also put them to sleep. We have an anesthesiologist that comes into the office, puts the kids to sleep. We do our treatment. It takes, on average, I would say about 45 minutes to an hour. The whole thing is done. And that's a very good option for those types of patients. So usually, like when the parents come in, we'll have a discussion about the different options. We'll talk about which one is best suited for them, and then go from there.
Can I come to your dentist office? This sounds great. I'm like, I want to come to see them. I told you that the last time I was here. You should see parents that have anxiety.
I know.
Because it's such like a calming environment. When you see the kids doing it, you're like, oh, I could do this. I just had a cavity filled, and I literally had anxiety, and they're like putting the shots in and everything else.
I'm anxious too. I know how it feels.
But they numbed it a lot before they did the shots, so it wasn't so
that's
bad.
good.
Yeah.
Good dentist.
Yeah, exactly. And we talked a little bit about brushing and ways to prevent cavities. I don't know if there's anything else that you want to add. No. Okay. And how do you make? Well, we talked a little bit about how you make them feel comfortable. Is there anything else that like parents could do to ease the child's anxiety, or like explain it to them before? Do you advise they do, or is it better just to let them?
So it's a really good question. I usually leave it up to the parents, and I think that the parents know their children best, and if their kids are the types of kids that need to be very well prepared before anything, and then they do well once they know it's coming, then by all means they can prepare them for it. And I like try to tell them, I wouldn't use the word needle, I don't use the word drill. Like when we talk to kids and we explain what we're doing, we have like the water sprinkler, we have Mrs. Bumpy, we have Mrs. Thirsty. We don't talk about the things in a scary way, and like The freezing, we just tell them we're going to put your tooth to sleep, you're going to feel a little push.
Right.
And so the kids are not so scared about it. But when parents explain it to kids, they have to also like watch the language that they're using, because the opposite can happen too, where like if they say it in the wrong way, then it can be very scary for a child. So I think most kids probably do better not knowing so much about what's happening. Like the parents can say, you're coming to Dr. Lori, she's going to clean the sugar bugs out of your teeth. Like that's, I think, probably the best way to go. And then when they come here, we go through all of the things that we're going to do before we do them. We show them everything, we let them feel everything, so that, you know, when they hear the sound of the drill, like they're not scared of it, because they know it's just the sprinkler.
Right. Well, thank you for joining us.
Thanks.
I think that you guys got amazing information. Be safe trick-or-treating. One of the things that I would advise all parents, sometimes you think you live in a safe neighborhood and you don't need to check your kids' candy. I don't know if you are big on that too. There are weirdos out there. There's some, I mean, this is more in the States, and I'm from the States, so maybe I'm a little bit more. People put razor blades in candy. People put poison in candy. Like, check your kids' candy before they're, before you give it to them. And have a safe Halloween and have fun. Parents, join your kids and dress up.
Will you dress up?
I am going to dress up. I don't know as what yet, but it will be something. My kids are going to be unicorns.
Nice.
I did the easy route, and I just got them matching unicorns onesies.
Yeah, very popular.
What are your kids dressing?
We're all going to be mermaids.
Oh, that's so cute.
And Steve's going to be a merman.
Oh,
so
nice.
we'll have a little mermaid clan.
Oh, that's nice.
Yeah.
Very cute. The Golden Girls. Well, thank you, and we will see you next week.
Thank you.